Hi, everybody. How are you? I'm told I shouldn't touch the mic, but it feels weird to go like this. I'll go like that a little bit. Um, so I have the privilege of introducing the next session, card sorting. Thank you. Thank you. It's better to let the professionals handle those things. I have the privilege to introduce this session, which is card sorting as a tool for UX democracy. And I just want to introduce our speakers. Kayenda Johnson, before joining the U.S. Digital Services team at the Centers for Medicare and Medicaid Services, CMS, Kayenda was a consultant providing both user research and user-centered design services to a variety of federal agencies, such as the FBI and the U.S. Secret Service. Kayenda is currently leading the user research efforts for the design of CMS's Quality Payment Program website and serving as human-centered design advocate within the broader agency. Creating great user experiences using in-depth user studies and contextual inquiry are among her personal passions. Beyond her passion for creating engaging user experiences for software applications, Kayenda also loves mentoring middle and high school girls towards strong character development and academic success. Catharine Robertson. Catharine has spent 20 plus years architecting information for organizations, including the Centers for Medicare and Medicaid, Legg Mason, the American Psychological Association, University of Pennsylvania Health System, and many others. She's currently working to establish enterprise UX and DesignOps practices for the Centers for Clinical Standards and Quality at CMS. Catharine founded the Baltimore UX Meetup and helped establish and currently teaches at the Maryland Institute College of Art user experience graduate curriculum. Her kitchen shelves have a solid research-backed information architecture. I can attest to that. I've been in her kitchen. It's very impressive. So please give them a warm welcome and we'll get started.
Hi, everyone. I'm Catharine. When Kayenda and I talked about what to do for this session, we talked about how we are both working in the Centers for Medicare and Medicaid, and can we somehow get card sorting outcomes into this talk along the theme with IA for Good. So that's what we're going to talk about today. So we're going to talk about democracy and participation. We're each going to tell some little anecdotes, and then here's a fair warning for you. There's going to be some breakout sessions. You don't need anything. You don't need Post-its or anything. You're just going to talk to each other, and then we're going to ask for people to report out on what they talked about. And I have a tablet up here so I can see my speaker notes. So that's a pretty picture of me. That's a pretty picture of Kayenda. And where are we now? Does anybody recognize this slogan? Washington Post, right. So they have adopted this slogan in the last year, which I'm told and everything I read has nothing to do with current events or who's in the White House or what's happening. It's actually been in the works for them for a long time. Woodward and Bernstein started using that phrase back in the Watergate days, but actually they didn't invent it either. They got it from a judicial opinion about who is subject to search warrants. And so if you shine a light on something, if you're transparent, then democracy can fully bloom. Whereas if it's completely in the dark, whether we're talking about current events or design decisions, democracy can be hindered if people's opinions and their collaboration are not taken into account. So democracy is self-government. People who participate in the governing process are the pillars of democracy. The majority control the organization, or if you're Wikipedia, the majority controls the truth. Consensus is the truth. Social equality can only come about through participation. So consensus is the name of the game, whether we're talking about our government or we're talking about products and services that we design. Okay, and I may need, no, I'm good. So if you participate, whether it's in your government through the election process or in a design process, you are theoretically represented. You're helping to govern the country, or you're helping to govern the organization, even if all you did was participate in a card sorting exercise. If you don't participate, you risk not being represented, or if you're not given the chance to participate, then there's a very big chance that you are not represented. So the way information spaces are designed can actually promote or hinder democracy, whether we're talking about something as large as our polling system, our voting processes. And I know Whitney Quisenberry is here, and there's a panel after this talking about, I think they're going to touch on voting design, but definitely civic design. It's the same for the design and construction of information spaces. If we design with the participation of people for whom we are designing, then they know they're represented, and they also feel more invested in the information space or the product or the service we're designing. And when our information spaces are designed without their participation, there's a risk that we won't understand them, or that people who are supposed to use them won't understand them. And confused, we or they may make choices they did not intend, or that we did not intend. So who recognizes what is on this photo? Anyone? Tell me what it is. It's not a game. This is a voting ballot from Florida from the 2000 election. So these were called CHADs, the little punch-through windows. So to vote in Florida in the 2000 election, you took a stylus or some punchy thing and you punched through what your intended choice was supposed to be. In that election, the race was so tight that Florida's 25 electoral votes were going to be the decider. And the result in Florida was so close as to trigger a mandatory statewide recount. So it's one thing to have to deal with this when you're voting. It's quite another when people are having to recount and determine your intention for your vote. Because as you can see, not all of them punch through. At least you might be able to see on the bottom. They don't punch through entirely. So these ballots had to be counted by hand, and a judgment had to be made about every single ballot in the state. So if you aren't old enough to remember that, or you're not from here and don't remember that, this actually took, I think, a couple of weeks, wasn't it a couple of weeks, for people to recount all this nonsense by hand. The Gore campaign requested that the disputed ballots in 4 counties be recounted by hand, so that's what happened. The Florida Supreme Court extended the deadline for the recount and ordered the manual recount. The Bush campaign appealed the decision, and the U.S. Supreme Court agreed to hear the case. So whether or not it was confusing to voters who actually punched them, when it came time for people to manually verify voters' intentions, there were a lot of problems. This was on the news every night with photos of people holding up a ballot, which was much less clearly punched out than this, where you had all these phrases like dimpled chads, which was if it was like a punch that didn't perforate entirely at all. So you were like, well, it's kind of a pregnant chad, it's a hanging chad. There were all these terms for chads. Crazy design of a voting ballot. So the ballot design was so poor that it literally hindered our democracy to the point where the Supreme Court had to decide based on the interpretation of the voters' intent. The voters essentially did not get to decide. I can't get this to move. And this is a ballot used in the same state, in Florida, from the same election. This is the infamous butterfly ballot. It was clearly designed without people's participation, probably without any usability testing. So this yellow strip down the center, you were supposed to be, again, using your stylus, your punchy thing, to punch a hole corresponding to your choice. And there were apparently a ton of votes for the candidate in the top space on the right side, and people had thought that they were voting for the candidate in the number 2 space on the left side. So this was yet another problem with ballot design. It proved extremely confusing to voters. There were a lot of votes recorded that voters did not intend to cast. And the way this ballot was designed did hinder democracy because people voted for candidates they did not even intend to vote for. So I want to tell a story based on some consulting work I've done. So right now I work for Centers for Medicare and Medicaid, trying to do digital transformation. I had a previous life with a design firm. We did a lot of healthcare system websites. So gigantic, not just a hospital, but many hospitals all together. And I want to talk to you about what patients call brain tumors. So several years ago, I had this client that's an internationally competitive cancer hospital. They're successful in drawing patients from their local area, from the region, from all up and down the eastern seaboard, nationally, and also patients flew in, particularly from the Middle East and Asia, to have their advanced cancers treated. They were also, sorry, I lost my place. The hospital's marketing department used a strategy of web ads for national and international patients and their families, but also magazines and billboards and TV. The marketing department tended to want to sell cancer treatment based on the cutting edge names of the treatments, like proton therapy, immunotherapy. If you've ever worked in marketing and healthcare, this probably sounds a little familiar to you. They have a new treatment, they want to market it because they're trying to get that differentiator between themselves and all the other healthcare systems. But what does a patient who hasn't even gotten the results of their CAT scan know about their treatment? What do they know about their cancer name? They don't tend to know names like glioblastoma or astrocytoma. They don't tend to know what proton therapy is or germ cell therapy. And the hospital was also indebted to its major donors. They had lots of donors that gave them like $50 million, $100 million. Name this part of the cancer hospital after me. Name this proton laser beam after me. So they had sponsored and paid for all these treatments, and they wanted their names on it. And the marketing department thought, well, we need to market it with, this person's name on it and this treatment name. But what happens when the people you're advertising to don't even recognize themselves in the advertisement? They're not going to be represented. They may not get the treatment they need, or it just may be a question of timing. What happens when their mental models of cancer and diagnosis and treatment don't at all match what seems to be on offer from this wonderful cutting-edge hospital? So we conducted card sorting. We actually didn't know that this terminology problem existed. So in planning the new information architecture for the cancer hospital, we did a card sort with patients and caregivers to find out what types of cancer terminology they use and recognize. And this example deals only with brain cancer, because it seemed to be the best one to illustrate it. It's an illustration of a problem we didn't know needed solving yet. We found that patients and caregivers tend to fall in three groups. There's essentially, when you know something's wrong or when you think something's wrong, at least from our card sorting results, people tend to have terms in their head like it's a tumor. It might be a brain tumor. They don't really have much beyond that. They haven't maybe even had their scan yet. Maybe they're in between their primary doctor and being referred to somebody to have scans, or maybe after the scan before the oncologist. So only patients and caregivers who already have a specific diagnosis and staging and grading tend to know the terms that this healthcare system was trying to use to market to all cancer patients. Looking at this now, years later, it seems like common sense, but how else could the hospital have understood this demarcation between three different groups of terms and three different groups of users unless we had done card sorting? So by doing simple card sorting, we were able to democratize the design of the cancer hospital's site, as well as the entire communication strategy and marketing strategy. And by doing this, we were able to let people participate in the design of their own treatment, often life-saving treatment. So this transparent, democratic design process also increased patient and caregiver overall satisfaction with the healthcare system. So that, at least, was a win-win for everybody. Can't get this guy to move. So our solutions in the design itself we essentially relied on progressive disclosure. So we started generic for anywhere that Google might bring someone or landing pages at the top of a site. We use the words that people would have only if they had no diagnosis yet, like tumor or brain tumor. And then in some descriptive copy, we might use words that people might have further along in the diagnosis process, like mass or lesion or metastasis. And it's only in the deeper pages, if people were really looking for this information, or if we tied it to campaign landing pages, that we use the actual cancer names, the highly technical treatment names, or things like grading and staging. And after 6 months, with the new information architecture, the cancer hospital site saw a 30% increase in conversion rate as measured by appointments made online. So even the marketing department changed their strategy. I cannot get this guy. Here we go. The marketing department had success advertising, as I said before, via billboards as well as TV and magazines. In the local area around the cancer hospital, they had been advertising things like proton therapy and laser treatment and all this stuff for people's cancer. And they were having fine results, but after seeing the 6-month increase in conversion rate, they started to mix into their marketing strategy billboards that had more generic terms for cancer based on the participation of people and getting the feedback from users about what terms they actually recognize. I think that's the end of my part. Thank you.
Thanks so much, Catherine. Good afternoon, everyone. I'm Kayinda. It's nice to see all of your partially smiling faces on this cloudy Saturday afternoon. Before I go into my card sorting story, I want to lay a little bit of groundwork for you, give you some context. So, as was mentioned earlier, I work for CMS, the Centers for Medicare and Medicaid Services, particularly on the Quality Payment Program. And my role on the Quality Payment Program, which we call QPP, is I am pretty much the primary facilitator for about 6 contracting user research and design teams. And so basically what I do is make sure that all of these teams who have some level of responsibility for the design for the Quality Payment Program, I make sure that they have the things that they need in order to do the research that they need, and they don't have blockers and so forth and so on. I also help them with strategy. So that's the primary role that I'm serving on the Quality Payment Program. But I have a secondary role, which I spend about 25% of my time working as a human-centered design evangelist at CMS. And so we want to spread the word about human-centered design and the benefits and values of the work and the activities that can be done. So with my evangelism, a couple of people have caught the bug and they want to include user research as a part of some of the work that they're doing. And so I had a colleague to ask me, she says, Kayinda, I want to use user research to determine the effectiveness of a paper dashboard that's being distributed to program executives, and this is for the Quality Payment Program. And so she's basically wanting to do a pulse check to see if this dashboard that she's been sending out for weeks and weeks and weeks is actually effective. And so given what she wanted to achieve and some basic knowledge about the design of the dashboard, I said to her, like, well, maybe you want to do a card sort. I'm not able to show you the card sort, the actual dashboard, because it's for internal use only, but I promise I will describe it so that you can get a mental picture in your head. All right. So I'm going to give you a little bit more context for the Quality Payment Program, just so that all of this makes sense. So the Quality Payment Program was born out of legislation called MICA. And MICA was enacted in 2015. And from MICA, the Quality Payment Program is being implemented, and QPP changes the way that clinicians that provide medical services to Medicare beneficiaries are paid. So they're moving from a fee-for-service type of payment model to a more value-based payment model. So in essence, what that means is, okay, yes, you ran this test, you did this particular procedure. We're not going to necessarily pay you dollar for dollar for what the cost was, but we want to integrate in your level of quality for caring for that patient into your reimbursement. And so we're looking to integrate quality into the actual reimbursement for the services that they provide. So that's kind of QPP in a nutshell. And so this is different from quality programs that they have participated in the past. Let's see. So what I think I will do now, oh, one other thing. So the way that the Quality Payment Program website fits into this is it serves several purposes. So of course it's going to be an informational website about the Quality Payment Program, how it's similar or dissimilar from other programs, what needs to be done, who needs to participate, all those kinds of things. But it is also the location where clinicians or those who would act on behalf of the clinician would log in and actually submit their quality data to CMS. So it's actually the tool that's being used for compliance with the Quality Payment Program. So it's pretty much a big deal. If they don't have the website, there's not a way for them to comply with the law. So QPP 2.0. So thinking about QPP from the operations perspective. So we have a website, that's the product, which is what I work on. But of course it has many, many components. So there are individuals that work on policy for the Quality Payment Program. There are individuals that work specifically on communications around the Quality Payment Program, just sending information out externally from CMS. There are individuals that work on education and outreach. We have technical assistance contractors that are literally boots on the ground, and they're helping clinicians within their practice figure out how to engage with QPP, how to participate, and just trying to work on breaking down any barriers that might exist for participating in the program. So there are a number of things that comprise the Quality Payment Program for CMS. There are a couple of other things listed there. Web analytics, of course, we're looking at those things to see how individuals are interacting with the website itself. And then, of course, we want to know what's the buzz, what are people saying, what are they talking about external to CMS about the program. So more about the actual dashboard. So envision in your mind a dashboard. It's a paper dashboard. It's built in PowerPoint. It's about maybe 5 or 6 slides long. And there are chunks of information on each slide. So you might have a chunk of text that is describing or summarizing some pertinent piece of information. You may have bar charts, pie graphs, different types of graphs to show data from the service center or from web analytics. There could be charts that talk about, who did we reach out to this week? Who did we send communications to? There's a lot of information about the service center, the type of calls that are coming in, who's calling, and what questions are they asking. So a number of things that would be important for the basic operations of the program. So if something is falling down, this particular dashboard would show that, and the executives will be able to act on that or to make some changes if necessary. So you can imagine this is PowerPoint. There are modules of information all around on each of these slides, and they're organized in ways around communication, service center, what have you. So one of the key things that my colleague wanted to achieve is that she says, well, we kind of created this and just gave it to them, but we don't know if it's actually serving the needs that they have. And so for the program executives, they have a wide range of roles. You might be talking about the CFO of CMS. You might be talking to or speaking about the chief technology officer. But then you're also talking about program staff or program executives that are running the actual quality payment program. So division chiefs and so forth and so on. And so they all have different levels of interaction with the program. But that really wasn't taken into account when the dashboard was designed. It was kind of like, here's the information, we're going to push it to you, and you use it however you please. And so, so basically, this was an opportunity to engage the program directors or executives and ask them, what do you need from this particular dashboard, what's extraneous, what's unclear, and all of that, so forth and so on. So let's see here. Make sure I didn't leave anything out. So I think I covered all of those ideas. So in terms of outcomes for the card sort, and so the way that the card sort was done was all the modules of information that I mentioned, they were broken out into individual cards. So you might have a card that's a chunk of text that's summarizing something. You might have a card that's a graph, or a card that's a table, or what have you. So it's all of the modules as they were laid out in the initial dashboard. They're all broken out into cards. And so those cards were put in front of executives, and these are high-level executives that were willing to sit down and do a card sorting task. And so each person had an opportunity to arrange those cards in a way that made sense for them and that was meaningful to them. So they were able to offer us their thoughts about what was important, what wasn't important, what was missing, what was unclear, and all of that. And so the results of that, of course, came with what you might imagine. We have a new structure for a new organization for the dashboard. But there were some interesting things that came out of the discussion as well that's related to the new structure. So talking to the various executives and putting all of the cards out in front and just creating an opportunity for conversation, there was a primary user. There were executives that kind of floated to the top as being primary users for the dashboard. There were others that are more on the periphery of the program, and so it was nice for them to get the information, but it wasn't critical. So our actual program executives really need the information to make sure that things are running the way that they're supposed to. Nothing is falling down and nothing is being missed. So that was interesting that emerged. They were able to figure out a way to organize the information that would be more actionable for the primary users. And also the new design allowed for just greater scannability. They're able to kind of look through it quickly and pick out some things without having to study it too much. And then second, there were new categories that emerged. So there was information that they said was missing. And so a lot of that had to do with, okay, yes, you were giving me all these disparate pieces of information, but we need some level of analysis to be presented here as well so that we have something that's immediately actionable. So that emerged. And so I think that's a really good add for this particular dashboard. So the last column is, in terms of an outcome, I think is a bonus. So what we realized is that doing the card sorting task, well, first, we were concerned, I was a little concerned that the executives would say, when we asked them to participate in the card sort, that they would say, what is this nonsense you're bringing me? You want me to sit down and move some cards around on a table? What are you asking me to do? But to our surprise, they were actually very, very engaged and really liked the idea of having something in their hands that they could move around and think about. So that was great. So they were engaged. But it was also, it served to be a really great carrot, if you will, or a really great catalyst for creating this larger conversation around human-centered design. After walking through the card sorting task, I think they got a greater appreciation for the energy and time that you need to spend when you are organizing information, specifically around individuals' tasks or individuals' roles. So I think they gained an appreciation for the fact that you don't just throw information on a page, but you really need to give some real thought to how you're organizing it so that those who receive it can consume it in a way that's actionable. And so we found this just to be a great tool for talking about human-centered design and introducing human-centered design to the executives at CMS. And so that was kind of a bonus. And so we'll continue to maybe use card sorting as an intro to human-centered design. So I'm going to stop talking. We don't want to bore you to tears with all of our stories, but hopefully, our examples are our examples, but hopefully our discussion has stimulated some thoughts in your mind about how you could potentially use card sorting as a way to create an opportunity for people to be represented, whether it's at work, in your community, or school, wherever it might be. And so we wanted you all to just take a few minutes to think about where you might be able to use a card sorting task to kind of create some more transparency in an area that really needs it. So we thought maybe 15 minutes. Let's see the time. Yeah, maybe 15 minutes. If you'd like to do this task on your own, that's fine. If you want to talk with somebody sitting next to you or a group of people, I think that's fine. But we just want to see if, hopefully, that this would have stirred up some things in your thinking about how you might be able to use it, and just create some discussion around that. And so basically, just think about your professional world, school, if you are participating in any local or community events, or anything that you might be doing or maybe have done previously. Any of those examples I think would be great. So I think we can start now, and maybe we will, maybe at maybe 10 minutes at 5 of 3, we'll come back and maybe listen to some of the ideas that you all have come up with. Any questions about that? No questions? Okay, great. Hopefully we want you to be able to take something away from this. So not just sitting here listening to us, but hopefully you can think through some of these things and use them for yourself. Okay, so we'll check back in about 10 minutes. Okay, everyone, if you could wrap up your conversations. You're still working on it? If you're still working, if you still need another minute, raise your hand. Okay. So you all can keep working, and what we'll do is we'll start, if anybody wants to volunteer, keep working, but if anybody wants to volunteer to tell us what you talked about, that would be great. Not all at once. It doesn't have to be a superstar idea. Okay. Why don't you come up here so that you can talk on the mic? I think it still needs to be amplified.
Hi, everybody. I'm Demetrius Gooseby. I have my group back there. We decided to talk about something that something has been on my mind. And actually, within corporate culture, we wanted to talk about dress code. So a little bit of background on us. We actually have some coworkers, and we have a new addition back there. We were a startup, and we were purchased by a large insurance company. Our startup actually was a wellness company that focused on lifestyle management and disease management. But as part of our sort of non-dress code, we would actually show up to work to the office in workout clothes. And that was, norm for us. So when the insurance company bought us, they of course have a lot more stringent dress code. So we had a couple of sort of like very tense periods there about talking about dress code. So albeit they haven't necessarily enforced our dress code, and now actually, if anything, we're finding that people are jealous of our office culture. But it did bring up the deeper thought of why there is a dress code. Why does sort of like senior leadership enforce a dress code? Why do other people sort of adhere to that dress code? So to have sort of like to start that process through card sorting, we were kind of wondering to really, because what it really dives into is 1, office culture, and 2, free will. And on how much does your free will allow you to do your job? If you find yourself adhering to a certain thing, are you really performing at the level that you could perform because you're adhering to another set of rules? So that's what we were talking about.
Other volunteers? We want to hear what you were talking about. I didn't come walking around. I didn't snoop, so you got to come tell us. Okay. Come on up.
We were talking about the possibility of speaking about the way we budget projects. I had a very unusual event where I got to meet a Lyft driver who works in the Pentagon, and he's in upper management. And he told us that he had not spent $250,000, and he told his team that that money goes back to the Treasury. Well, how many projects have you ever been on where somebody says, we're at the end of the quarter and we haven't spent all of our training budget, we haven't spent this, that, or the other thing? Everybody? Yeah. But that money could go back and be saved because you didn't spend it. But people don't do that because they're afraid they won't get the money. But he was determined that that's our money. We pay into that. So what we were talking about was maybe if we do a card sort to understand how people talk about the different things that we spend the money on and get a little clarity on it, because sometimes we don't know, for example, where to allot our time for when we're saying we spent money on recruiting, or I don't even know, I can't think of it, prototyping or whatever. And if we put more clarity around the labels, then we could potentially help people not fall into the cracks and not misallot the money.
Awesome. Those are two great examples. So there's a part 2 to this little activity. And hopefully the other teams, the other groups, you came up with something, because this is going to take it to the next level. And you've probably already started doing this in your groups. But as the 2 groups that came up, I think you've already started thinking about some of these. If you were to actually build out your idea into a card sort, what would it look like? So up here you see some of the questions that you might want to ask. What is it that you want to achieve? How would you design your card sort? Who would your participants be? And then just any other things that you think you might need to be aware of or mindful of once you're actually able to implement whatever change you had, if you're able to implement a change. So if you could get back into your groups and just dive a little bit deeper and think about how you would actually set up your card sort to resolve whatever the issue was, I think that'll be great. And then we'll ask for more volunteers. Okay? All right. So we will maybe 10 minutes. Okay. So we'll go with 10 minutes and then we'll break and then we'll have our volunteers. Okay? All right. Okay, everyone. I'm glad to hear all this conversation, but we have about 5 minutes left in this session. So we'd love to hear what you've come up with so far. Even if you haven't, answered all the questions, that's okay. But we just love to hear where you've gotten to this point. Okay, you can come on up.
Hi, so our group did something completely different. Basically, we were discussing, it sparked up a conversation with the first exercise as to what if there was a group of folks that lived in a neighborhood and say there was an issue on security and we wanted to build more of the community. And by getting together as a group, we wanted to be able to form this community, but we started by taking a few other things into consideration. Now, without going too much into the first exercise, tying in with what we wanted to achieve, well, we wanted to further develop as the community as a whole. And that would allow us to address a lot of these issues that the community would bring up. What did that mean? That means meetings, organizations, issues, and ways to resolve these issues. So with regards to how would we design our card sort, 4 to 5 main concepts that we could then prioritize, things that would determine how often we would want to meet, issues and topics, and we would do an open card sort to prioritize the ideas and a closed card sort for some of these solutions, but we would limit the cards to like 4 to 5, no overwhelming. With regards to who the participants would be, well, it's the residents, it's the local merchants, and what else would we need to consider? And the biggest thing here is feasibility. And that's it. Really fast.
That was great. Do we have another team that wants to tell us? Okay, come on up.
Hello. So we had started talking about something that had come up, one of my issues, which was I recently joined a startup and it's doing well. We're about to double our numbers, but that means instead of hiring our friends, we have to hire a bunch of strangers. And we've never really thought about what our culture really is. It's like, oh, we hired the people we've been working with for the last 10 years and that we already know. So we were talking about how we could design a card sort to figure out what values were important, and therefore we could use it to design our hiring processes and also document what our culture was, so that we could continue to look for that as we grew as a company. And one of the interesting things that I think came up out of the conversation is it's just as important to design what the culture is as what the culture is not, and what activities and things we wouldn't want to be doing or want to kind of veto. Like dress code maybe. But another consideration was that we also have to consider the culture of the clients that we've chosen to bring on, even though it might not be the exact same thing as us, because having new hires that represent those values could also be valuable, even if we don't have that for ourselves. But that was an additional consideration that we discussed.
We are right at time, but if there's another team that's burning to share, we'll make time for you. Okay, I guess not. But thank you so much for engaging in that. You exceeded my expectations actually with the ideas that you came up with. So if you all are able to, if you're inspired enough by this to actually to carry out your card sort, we would love to hear about it. So you could find a way to maybe contact, maybe send an email to World IA Day. Or send a tweet or whatever. We'd love to hear if you're able to actually get this done and what becomes of it. So thank you so much. We appreciate your engagement and your participation and your listening ears. Have a great afternoon.